Tuesday night's presidential debate, Vice President Kamala Harris gave a rambling and incoherent statement that seemed to imply the Supreme Court's overturning of Roe v. Wade had forced women to travel out of state for in vitro fertilization treatments.
Couples who pray and dream of having a family are being denied IVF treatments. What is happening in our country? Working people, working women who are working one or two jobs, who can barely afford childcare as it is, have to travel to another state to get on a plane sitting next to strangers to go and get the health care she needs. Barely can afford to do it, and what you are putting her through is unconscionable.
It remains unclear what the vice president meant by that political word salad. I mean, IVF is legal in all 50 states. And I'm not sure where the plane and the strangers came in. Well, joining me now to discuss this is Dr. Marguerite Duane. She is a board-certified family physician and the executive director of FACTS, the Fertility Appreciation Collaboration to teach the science, an organization dedicated to educating healthcare professionals and students about the scientifically valid, natural-based family planning methods. Dr. Duane, welcome to Washington Watch.
Thank you so much for having me.
Now, let me ask you, are you aware of any place in the country where IVF is not allowed?
No, I'm not aware that IVF is not available throughout the country. My understanding, again, I'm not a lawyer, I'm a physician, but to my knowledge, IVF is legal. But where women do need to travel extensively is to seek physicians who are trained to provide comprehensive reproductive health care through a restorative lens, one that's really designed to treat the underlying causes of infertility. And in fact, I've had patients drive 4 to 6 hours to see me to receive the kind of care that I'm trained to provide, and we currently train physicians across the country to provide. Again, care that is real women's health care that seeks to identify underlying causes of infertility and treat those through a restorative reproductive approach.
And is also respectful of human life.
Exactly. We recognize that the human life, the science shows us, in fact, that human life begins at the moment of fertilization or conception. And our goal is to help restore both men and women their reproductive health system so it functions normally so that they will be able to procreate naturally. Now, sometimes this does require support with medications, surgeries, and certain treatments, but the goal is to restore their health so that their reproductive system functions so that they can conceive children and bear them naturally. But again, very, very few physicians are trained in this approach to reproductive medicine, which really is an empowering approach. It really educates men and women about the reproductive system. It helps them to address a wide range of health issues, everything from painful periods to irregular cycles to premenstrual syndrome. It addresses common causes of recurrent miscarriage. I mean, Vice President Harris talked about the pain and the heartbreak of women who have experienced miscarriage, and miscarriage is a very, very common problem. And yet as physicians, we are not trained to identify and treat modifiable risk factors of miscarriage, which is heartbreaking. And through my work, through facts about fertility, this is what we aim to do. And next week, I'll be presenting at a family medicine conference in Philadelphia on this very topic. How can we identify and treat those underlying causes that could lead to miscarriage so we can truly provide real health care to women and men?
You mentioned the miscarriages and the vice president, her comments there, suggesting that pro-life laws in various states are prohibiting doctors for treating women who show up at a hospital because of a miscarriage. Again, yes. I'm not aware of that.
And it's simply not true. And I can tell you, as a physician who cares for patients who regularly experience miscarriage, we are trained to provide both medical and surgical treatments to treat miscarriage. Now, the difference between a miscarriage and an abortion is with miscarriage, the embryo has already passed. The heart has stopped beating. The child is no longer alive. Now, women can experience what we refer to as a missed miscarriage, meaning that the embryo has died, but the pregnancy is still continuing. And sometimes that does require medication or a surgical procedure. And as physicians, it is our obligation to care for both patients, both the unborn child and the mother. And if her child has passed, if that embryo is no longer living, it is our duty and our obligation. And I can tell you as a physician, I have had to order the medications that are sometimes used in abortion to cause an abortion. I've had to use similar medications to help treat my patients with miscarriage, and I've never been prohibited from doing so. So that's simply not true. The other thing that's important to note is this notion that, well, we need abortion because women later on in life or further along in a pregnancy may be forced to carry to term. The reality is that if a pregnancy is at risk or if the baby has already died, we can induce labor without causing an abortion, without violently destroying the unborn child. So the reality is our healthcare system gives us the freedom to provide true reproductive healthcare, and we do not need abortion to truly care for women.
Well, we need to have a conversation then with the vice president because she obviously doesn't understand that.
And I'm happy to, both to address the miscarriage issue and the infertility issue, again, through a lens that restores and empowers patients to care for their fertility and reproductive health.
Yeah, the issue is it's not a big business, and that's what I think they're interested in.
That is exactly the point. Thank you.